This is an evidence-based project presentation. IPC 401, nurse turnover. My name is Matt Suter. Some objectives: we're going to introduce nurse turnover, the purpose and reason for conducting this evidence-based practice presentation, research question, literature search, a literature synthesis, and practice and management recommendations. So nurse turnover is estimated that the demand for registered nurses will rise 2 to 3% annually by the year 2025. This means a shortage of 500,000 RNs just in the US alone. Many countries around the world are experiencing staff turnover, which can range from about 12 to 50% of staff at times. And it's estimated that nurse turnover can cost roughly about $21,000 in Australia. Australian currency compared to the United States currency is about 69 cents to US to the Australian dollar. So purpose and reason for this topic was due to personal work experience with nurse turnover in several departments that I had previously worked in. This is a major concept in healthcare today, and any help to reduce turnover can help save healthcare organizations millions of dollars. And it improves quality of care for patients. So those are two major concepts. So the identification of key concepts that influence nurse turnover should be identified and steps taken to create a work culture that is free from these concepts. PICO question: based on patient or population, an intervention, a comparison, and the outcome. So the population in this case is going to be registered nurses' job turnover. The intervention will be healthcare management education and culture change. Comparison to that would be no culture modification or education completed. What will indeed happen if the nursing turnover phenomena is not able to be reduced? And the outcome of actually being successful will improve nurse retention and improve higher quality of care for our patients. So literature search that was conducted, the Pennsylvania College of Health Sciences library databases was utilized. The first search was conducted using CINHL Complete, and the search criteria was nurse turnover qualitative, in order to identify the key topic and a focus for more of a qualitative survey, which would help identify key concepts of nurse turnover. So results were narrowed to full text peer-reviewed articles between the years 2014 and 2019. 3 articles were chosen of the 874 results, and this was due to focusing on primary sources, which was based upon authors conducting their own data collection and interpreting those results. This was they were all based on qualitative surveys, and those were the 3 articles that were focused on for the majority of the key concept identification. Some difficulty was had trying to search for those primary sources. So another database was utilized through Academic Search Premier. Search term was nurse turnover, which resulted in 101 articles. The first one was HIAN, which was based off of qualitative and quantitative article that helped identify key concepts and actually focused on nurse population ages that were more prone to nurse turnover. The second one was a article based on identifying nurses' intentions after they actually had resigned and what they were going through, their feelings. So literature synthesis was conducted. After analyzing all 5 articles, a comparison can be made to 3 of the articles in general. This was based on Hayward, and the nurses' decisions to leave the practice. Hayward states that nurses' decisions to leave practice were influenced by several interrelated work environment and personal factors. This led to identification of higher patient acuity, increased work demands, and ineffective work relationships. This ultimately impacted the health and emotional well-being of the nurses. And this study in general perceived more of a turnover among nurses that were a little older and had more experience in the nursing field. HIAN added that nurses' turnover intention was associated, again, with stress, age, job duty, and career commitment, kind of going on Hayward's example of the higher stress work environment and the social construct of nurses really not caring, after their own, really. Again, this being consistent with the 3 articles that were chosen. In this particular article, a younger age group was associated with higher turnover intention. And this was due to the nurses feeling less experienced and dealing with more professional stress. In particular, a subgroup of females in this age group were higher than men to leave due to the implications of maternity leave and the expectations of the culture. Dawson found common themes as well associated with nurse turnover that aligned with limited career opportunities, poor support, and lack of recognition, and negative staff attitudes. Again, kind of hinting on the same key concepts of just basically a poor work environment, emotionally and physically. These survey responses indicated that the nursing work environment was polluted with a poor skill mix and inadequate patient to staff ratios. Again, aligning with the common themes. The last 2 articles in comparison were Bragg and Bonner was the article that it was a qualitative survey that was conducted among nurses who had resigned from their job since January 1st, 2000. Now, what was interesting about this survey was that 16 of the nurses that were actually the basis for the study, 12 of those actually indicated that they were currently not working in nursing and that they would not even return to their previous place of employment. This was based on a conflict of the nurses' values as opposed to the hospitals. And was a major implication for their resignation. So I thought that this was useful in that if we aren't effective with hindering a nurse turnover, this is actually shows the evidence of these nurses actually would not even return. So you couldn't stop them from leaving, and you couldn't actually even recruit them back. They were gone. This explains the whole nursing shortage and how this can be a vicious cycle of, nursing and nurses completing their education, which can take several years. And it actually can lead to this part in their career and in the profession that we are left searching for nurses. The last one was a qualitative survey based off of a orthopedic surgical department, and they enacted reduced work hours. So 6-hour days 4 times a week and an 8-hour day, and 2 of those hours for the 8-hour day actually were specifically set aside for administrative work tasks. So like anything the nurse had to do as far as like continuing education or like, fine tuning some things. This eliminated staff breaks, and actually their original salary was maintained. So even though that they were cutting their hours back, they still maintained their same salary for that 40-hour work week, what have you. Which actually, going through the results of that survey, empowered the nurses that they felt that they were so lucky that they were able to have this work-life balance, and they were still able to earn a reasonable living. This actually led to increased productivity, where this center increased their surgical caseloads in order to increase their staffing levels to recruit more nurses to fill a wider range of productivity. This ultimately led to a more sustainable working situation and improved the nurses' work-life balance, so happier nurses. So going on that, some practice management recommendations that can be used to increase job satisfaction and alleviate nursing shortages, that vicious cycle that we should say. So high-end focused, they brought to mind that actually in their survey, nurses aged 30 to 39 were pivotal predictors and could actually benefit from some age-based promotion. So we need to focus on that age group in order to give them a little something extra to say, hey, we appreciate what you're doing, stick around and be pivotal in our institution. Also, a higher job responsibility led to higher retention. So if they felt that they were more important, this also could be a performance-based promotion could be utilized there to keep these people happy. I in particular think that a sign-on bonus would help promote new graduates with a service requirement, keep that specific age group around that 25 to 29, because that they would feel that they would need to stay there. So I think, again, having easily accessible, affordable continuing education, flexible work schedules, and reduced workload would lead to better overall nurse retention. So in conclusion, the United States will experience a nursing shortage forecasted through the year 2025. This will be costly and impact the quality of care throughout healthcare. It is imperative that effective management and supportive strategies are needed to reduce nurse stress and discourage nurse turnover, that vicious cycle. I thank you for watching.